top 3 sleeping positions to prevent stroke for seniors. Hello, everyone. As we age, one of the most crucial factors in maintaining health isn't just diet or exercise. It's also our sleeping habits. What many don't realize is that the right sleeping position can significantly reduce the risk of stroke. Did you know that your sleeping position plays a critical role in protecting your heart and brain health? As a healthcare professional specializing in elderly care, I've witnessed many of my patients improve their cardiovascular health simply by making small changes to their sleeping habits. In today's video, I'm going to share with you the top 3 sleeping positions that can help prevent stroke, improve heart health, and protect the nervous system. Don't forget to hit like and subscribe to our Senior Care Wellness channel to get more helpful videos on senior healthcare tips. Let's dive in and discover how changing your sleeping habits can lead to long-term health benefits. 1. Sleeping on the left side. Reducing pressure on the heart and brain. As we enter our 60s, heart health and blood circulation begin to have a more significant impact on our quality of life. Issues related to the heart, such as high blood pressure, arterial diseases, and the risk of stroke become increasingly common. One factor that greatly affects cardiovascular health is sleep position. While many people focus on diet and exercise, the right sleep position can play a crucial role in maintaining heart and brain health. Among the various sleep positions recommended by experts, sleeping on the left side is considered one of the best, especially for older adults. When we sleep on the left side, gravity works to enhance blood circulation to vital organs, particularly the heart and brain. Studies have shown that lying on the left side optimizes the positioning of internal organs, such as the heart and stomach, allowing the heart to work more efficiently and improving blood flow throughout the body. This is especially important for individuals with a history of cardiovascular problems or strokes, as it helps to maintain proper circulation and reduce strain on the heart. One of the primary reasons why sleeping on the left side is encouraged by healthcare professionals is its ability to reduce pressure on the aorta, the main artery that carries oxygenated blood from the heart to the rest of the body. When lying on the left side, gravity reduces the direct pressure on the heart, enabling blood to be pumped more effectively throughout the body. This helps alleviate the strain on the cardiovascular system, especially for those with high blood pressure, anemia, or heart disease. Additionally, sleeping on the left side can reduce pressure on the major veins, which are responsible for transporting blood back from the limbs to the heart. By lowering the pressure on these veins, blood can flow more freely back to the heart, which helps to reduce the risk of blood clots or blockages. Blood clots are a leading cause of strokes, and improving circulation in this manner can significantly reduce the likelihood of a stroke occurring. Stroke is one of the most serious health issues that older adults face. One of the primary causes of stroke is a blockage in the arteries or a reduction in blood flow to the brain. Sleeping on the left side can lower this risk by improving blood circulation to the brain. With enhanced circulation, the brain receives the oxygen and nutrients it needs, which can help reduce the risk of stroke caused by insufficient blood supply to brain cells. By sleeping on the left side, you are also relieving pressure on the central nervous system, allowing the brain to function better during sleep. Specifically, getting adequate sleep in this position supports the restoration and regeneration of energy in the brain, which reduces the risk of age-related neurological diseases, including Alzheimer's disease. In addition to the cardiovascular and brain benefits, sleeping on the left side can also help alleviate acid reflux, a common issue for many older adults. When lying on the left side, the stomach is positioned lower than the esophagus, which helps prevent stomach acid from flowing back into the esophagus. This can reduce the discomfort associated with acid reflux, such as chest pain, heartburn, and indigestion. For older adults who suffer from chronic acid reflux, this sleep position can be an effective solution to improve sleep quality and reduce unpleasant symptoms. Older adults, particularly those with high blood pressure, heart disease, or a history of stroke, are at a greater risk for circulation and cardiovascular problems. Sleeping on the left side not only reduces pressure on the heart but also promotes better blood circulation, ensuring that the brain receives the oxygen and nutrients it needs throughout the night. As we age, our bodies require support from healthy lifestyle habits to maintain heart health and protect us from blood vessel-related issues. Sleeping on the left side can be a simple yet effective way to reduce the risk of stroke and cardiovascular diseases. Sleeping on the left side improves blood circulation, supports heart and brain health, and helps alleviate acid reflux. This simple sleeping position offers a wide range of benefits, especially for older adults. If you haven't yet tried this position, start today. To improve your cardiovascular health, protect your brain, and reduce the risk of age-related conditions. With these advantages, sleeping on the left side could be one of the easiest and most effective changes you make for better health as you age. 2. Sleeping on your back, reducing neck pain and enhancing breathing. As we grow older, both our health and sleep quality naturally change, often bringing new challenges. One of the most common issues older adults face is neck pain and difficulty breathing during sleep. Fortunately, adopting the right sleeping position can help resolve these problems effectively. Sleeping on your back or lying flat is widely recommended to alleviate neck pain, improve breathing, and boost blood circulation, ensuring that the brain receives a continuous flow of oxygen throughout the night. One of the primary advantages of sleeping on your back is its ability to relieve pressure on the neck and respiratory organs. When lying flat, the neck and head are not twisted or compressed, reducing the chances of neck pain or stiffness. This is particularly beneficial for older adults, as neck pain and joint stiffness are common, especially when the body isn't properly supported during sleep. As the neck is held in a neutral, relaxed position, there is less strain on the muscles, which can significantly reduce the discomfort that often arises from poor posture while sleeping. This position ensures that the spine stays aligned, helping to avoid the misalignment that may cause neck stiffness and pain. Sleeping on your back also brings significant benefits for respiratory health. In this position, the lungs and bronchial tubes are not compressed, which promotes easier and more effective breathing. The airways remain open, allowing for better oxygen flow throughout the night. This is especially important for older adults who may have a history of respiratory problems, such as asthma, chronic obstructive pulmonary disease, COPD, or heart conditions. When the body is not under pressure from poor sleep posture, breathing becomes more efficient. This can help reduce the risk of developing further respiratory or cardiovascular conditions. Proper posture encourages better lung function and oxygen intake, which is essential for maintaining overall health, especially for individuals with heart disease or high blood pressure. Another major benefit of sleeping on your back is the improvement in blood circulation. When you lie flat, gravity has less of an impact on the circulatory system, making it easier for blood to flow freely through the body. This is particularly crucial for older adults who may be at higher risk for stroke or heart disease. Efficient blood flow ensures that the body receives the nutrients and oxygen it needs to function properly. In particular, this position helps prevent pressure on the veins and arteries, reducing the risk of circulation problems. By ensuring that these critical vessels are not compressed, blood can circulate more efficiently, bringing necessary nutrients to the brain and heart. This improved circulation also strengthens overall health and supports better functioning of the cardiovascular system. While sleeping on your back offers numerous advantages, maintaining proper head and neck alignment is key to maximizing the benefits. The head and neck must be supported correctly to avoid muscle strain or compression of blood vessels. If the neck is overly arched or the head isn't supported properly, it can lead to neck pain and headaches the following morning. To keep the neck in a neutral position, it's important to use a pillow with the right height and firmness. A good pillow will ensure that the neck is not tilted too far forward or backward, which helps avoid unnecessary strain on the muscles and ligaments. The pillow should support the natural curve of the neck, allowing for restful sleep without discomfort. For added support, you may want to consider using an orthopedic pillow, which is designed to relieve tension on the body and offer improved neck and spine support throughout the night. Let me share the story of Mrs. Ann, a 72-year-old patient who had been struggling with neck pain and difficulty breathing at night. She explained that every morning she woke up with a stiff neck and often felt fatigued, sometimes having trouble taking deep breaths during the night. After evaluating her condition, I recommended she try sleeping on her back to improve blood circulation and reduce pressure on her neck and respiratory system. After following this advice for a few weeks, Mrs. Ann returned for a follow-up and reported significant improvements. She shared that her neck pain had greatly reduced and she found it much easier to breathe while sleeping. Moreover, her sleep quality had drastically improved and she no longer woke up feeling exhausted. By sleeping on her back and using a supportive pillow, Mrs. Ann noticed a remarkable difference in both her overall sleep quality and her general health. Sleeping on your back not only helps to relieve neck pain, but also improves breathing, especially for older adults. By maintaining proper posture, you can improve blood circulation, reduce pressure on the heart and brain, and alleviate respiratory issues. If you suffer from neck pain or circulation problems, sleeping on your back is a simple but effective solution for improving your sleep quality and overall health. If you're struggling with similar issues, try sleeping on your back tonight and see the difference it can make for both your sleep and overall well-being. 3. Sleeping on the right side, enhancing brain blood flow. When it comes to sleep positions, much attention is given to sleeping on the left side, especially for older adults, as it is said to reduce pressure on the heart and brain. However, many people overlook the benefits of sleeping on the right side, which can play a significant role in preventing strokes and enhancing blood circulation to the brain. This sleep position may not be as well known, but it can have a profound impact on your cardiovascular health and overall circulation, especially for individuals with high blood pressure or a history of strokes. Sleeping on the right side allows gravity to help reduce the pressure on the major blood vessels, particularly the carotid artery. The carotid artery is one of the primary blood vessels responsible for supplying blood to the brain. When you sleep on your right side, this position helps reduce the pressure on this artery and other critical blood vessels, thereby improving blood flow. This is particularly beneficial for people who have a history of stroke or cardiovascular problems, as it can reduce the risk of vascular blockage and promote better circulation to the brain. With improved blood flow, the brain receives more oxygen and nutrients, which are vital for healthy brain function. This in turn helps reduce the likelihood of strokes and other related neurological issues. For older adults, one of the major advantages of sleeping on the right side is the relief of vascular congestion. When sleeping in incorrect positions, such as on your left side or on your back, there is a higher chance of compressing or stressing the major arteries, including the carotid arteries. This can significantly limit the flow of blood to the brain. However, by sleeping on your right side, pressure is relieved and blood circulates more freely throughout the body, especially to the brain. As a result, this practice helps improve cognitive function, boost memory retention, and decrease the risk of brain-related health issues, such as strokes, cognitive decline, and memory loss. Moreover, for individuals dealing with high blood pressure, sleeping on the right side can have additional benefits. By reducing the pressure on the arteries, the position helps stabilize blood pressure, which is crucial for maintaining overall cardiovascular health. When blood pressure is stabilized, the heart and blood vessels don't have to work as hard, lowering the risk of cardiovascular diseases, including heart attacks and strokes. Stabilized blood pressure ensures that the cardiovascular system can function more efficiently and without strain. Despite these advantages, it is essential to keep in mind that sleeping for prolonged periods in one position, including the right side, can lead to other physical issues. One of the most common problems caused by staying in a single sleeping position is discomfort or pain in areas like the neck, shoulders, and back. These areas may become compressed, especially if the body is not properly supported. When this happens, muscle tension, stiffness, or soreness can result, causing you to feel fatigued, upon waking. Therefore, it is highly recommended to change sleeping positions during the night. Alternating between sleeping on your right side, left side, and back is key to relieving any pressure on your body and ensuring that you maintain comfort and flexibility during sleep. Experts recommend rotating sleeping positions regularly to reduce the impact of sustained pressure on any part of the body. Alternating between the left and right side, as well as sleeping on your back, can help reduce strain on your joints and muscles, allowing for a deeper and more restorative sleep. A good night's sleep is essential for your body's recovery, especially for older adults who may already be experiencing age-related stiffness or pain. Helen, a 70-year-old woman who had suffered a mild stroke a year ago, is an excellent example of how changing sleep positions can benefit health. After her recovery, Helen found that her body no longer felt as flexible, and she began to experience blood circulation issues and high blood pressure. She was also frequently suffering from headaches and fatigue. When I recommended she try sleeping on her right side, she was hesitant at first, but agreed to give it a try. The results were remarkable. Over time, Helen reported that her blood pressure became better controlled and the headaches and fatigue she had been battling for months significantly improved. She shared that every morning she woke up feeling more refreshed and energetic, which she attributed to the change in her sleep position. However, it's crucial to note that while sleeping on the right side can offer numerous benefits, you must ensure that your head and neck are adequately supported to avoid strain or discomfort. A supportive pillow is essential for maintaining proper alignment of the neck and spine. The pillow should keep your neck in a natural position without too much tilt or bend to avoid waking up with stiffness or pain. Finding a pillow that provides the right support for your sleeping position can make a significant difference in ensuring that you experience the full benefits of sleeping on the right side. In addition to proper support, paying attention to your overall sleep environment is crucial for a good night's rest. Ensure that your mattress and pillow provide the right amount of firmness and comfort for your body, and create a relaxing environment that promotes deep, restorative sleep. When you sleep well, your body has the time it needs to recover and regenerate, which is particularly important for older adults who may experience more difficulty with recovery. Sleeping on the right side offers several significant benefits, including improved blood circulation to the brain, better management of blood pressure, and a reduction in the risk of strokes and cardiovascular diseases. This sleep position can be especially helpful for individuals with a history of stroke or hypertension. However, to maximize these benefits and avoid discomfort, it is essential to alternate sleeping positions and use a supportive pillow to ensure proper alignment. By making small adjustments to your sleep habits, you can improve your overall health and maintain good cardiovascular and brain function well into old age. Try incorporating these changes into your nightly routine for better health and well-being. How to prevent stroke with proper sleeping positions. As we age, maintaining a healthy lifestyle goes beyond diet and exercise. It also includes an often overlooked factor: sleep posture. A good night's sleep not only helps the body recover, but also significantly affects cardiovascular health and brain function. In particular, poor sleeping habits can increase the risk of stroke, making it crucial to adopt proper sleeping positions for better health. In my work caring for older adults, I have seen many patients experiencing cardiovascular issues and high blood pressure related to improper sleeping habits. Today, I'd like to share how sleeping in the right positions can prevent strokes, improve sleep quality, and protect heart and brain health. 1. Establish a healthy sleep routine. Helping the body recover and maintain heart health. One of the most important factors in protecting heart health and reducing the risk of stroke is establishing a consistent sleep schedule. Going to bed at a fixed time every night allows the body to regenerate and recover effectively. Experts recommend that older adults get 7-8 hours of sleep each night, as this is the time when the body heals itself, improves circulation, and allows the heart to rest. Having a regular sleep routine helps maintain the body's natural circadian rhythm, reducing fatigue and stress. When the body is fully rested, blood pressure tends to stabilize, lowering the risk of strokes and other cardiovascular problems. I've worked with many elderly patients, and sticking to a regular sleep routine has made a noticeable difference in improving their overall health and circulatory systems. Helen, a 72-year-old patient of mine, had a history of high blood pressure and daytime fatigue that kept her from engaging in her favorite activities. After advising her to go to bed at the same time each night and ensuring she got 7-8 hours of sleep, she experienced significant improvements in her health. She felt more awake and alert in the mornings, and her blood pressure became more stable. 2. Ensure proper sleeping posture, reducing pressure on joints and blood vessels. In addition to going to bed on time, maintaining the right sleeping posture is essential for protecting cardiovascular and brain health. Regardless of which position you choose, make sure it is comfortable and doesn't put pressure on your joints or blood vessels. Sleeping on your back or left side is recommended because these positions help reduce pressure on the heart and improve circulation. However, for those with high blood pressure or a history of stroke, sleeping on the right side can also help relieve pressure on the brain's blood vessels, improving circulation and minimizing artery blockages. Another important factor is ensuring that when sleeping on your back, you use a supportive pillow to avoid tilting your head or neck too much. This prevents muscle strain or compression of the blood vessels. A supportive pillow keeps your head and neck in a natural position, promoting proper blood flow and reducing stroke risk. 3. Reduce stress before bed, enhancing brain circulation. An often overlooked factor in preventing stroke is reducing stress before going to sleep. Stress and anxiety are key contributors to high blood pressure and increase the risk of stroke. Stress hormones like cortisol and adrenaline can raise heart rates, causing the body to enter a high-stress state that negatively affects circulation and puts extra pressure on brain blood vessels. Before bed, try relaxation techniques such as meditation, deep breathing, or listening to calming music. These methods help relieve stress, reduce tension, and prepare the body for a better night's sleep. A study by Harvard Medical School showed that individuals who practiced relaxation techniques before bedtime had more stable blood pressure and a reduced risk of stroke. One of my patients, Mr. William, 68 years old, had a history of high blood pressure and often felt anxious before sleep. After teaching him deep breathing and light meditation techniques, he shared that he felt more at ease at bedtime and noticed that his blood pressure was more stable the following morning. To prevent stroke, in addition to maintaining a healthy diet and exercising, it is also essential to establish a healthy sleep routine. Maintain a comfortable sleeping position and reduce stress before bed. Quality sleep combined with healthy lifestyle habits not only protects cardiovascular health, but also improves blood circulation and reduces stroke risk. Begin making these changes today to improve your sleep quality and protect your health in the long run. Advice from Dr. Ryan Davis. The right sleeping position does more than just ensure a restful night. It plays a crucial role in protecting your cardiovascular health and preventing strokes, especially for older adults. When you choose the correct sleep posture, such as sleeping on your left side, sleeping on your back, or sleeping on your right side, you not only improve blood circulation, but also reduce pressure on blood vessels, supporting your body in maintaining overall health. Start applying these sleep positions today to protect your heart, brain, and long-term health. A good night's sleep will help you wake up every day with energy and great health. If you found this video helpful, don't forget to hit like and subscribe to our Senior Care Wellness channel to stay updated with more useful videos on how to care for the health of older adults. Share this video with your loved ones and friends to help them prevent strokes and maintain long-term heart health. Start making changes today and protect the health of you and your loved ones.